I'm so honored to be here in front of this esteemed audience. Thank you. So I'll just begin. What if I told you, with talking on a niche super specialty like unilateral bipodal endoscopy, for the past 365 days, I have garnered almost 1 million plus views on my LinkedIn account with 200,000 plus members that have been reached over the past 365 days, and with a 16,000 engagement rate with people who are at a senior position in their hospital and medtech industries. You'll be surprised. You'll say I'm joking, but I'm not joking. This, my dear friends, is the power of social media, the scale, the reach, and the global appeal. When I started with social media, I never thought this would have ever been possible, but I tried to document everything, my learnings, and my mess became my message. And this is how we come here. So the minds of people on LinkedIn are way different than the same minds that are on Facebook or Instagram. So this distinction is very important. Like, many people try to create content for Facebook, but Facebook, we are like fun, party, these things. But if you are educationally minded, LinkedIn is the most important thing. LinkedIn has transitioned itself beautifully from a platform for a job seeking to now for thought building, personal leadership, and KOL and DOL positions, and to gain a lot of collaborations, as Sanjay just was mentioning, about medtech and different societal collaborations. So this presentation will be a story of teaching this ultra niche super specialty of UBE through social media. So I just begin. You'll feel bored pre-hunger, but I need to touch on the 6 principles of adult learning that is mentioned by M. Novels in 1980. So, and how social media leverages this and how adults learn. The first one is adults need to learn. They need to know that what they learn, they need to understand the main aim. The second one is the self-concept. They have a self-concept that, yes, I am a spine surgeon, I am something. So I need to learn these things for my... So with social media, you can follow the people that you like, whose work you like, and you can follow all these things. They have leverage, they have own experiences, their readiness to learn, they have intrinsic motivation. So all these things are satisfied by social media. So this talk will encompass some posts that have gone viral, and I've taught endoscopic spine surgery through these posts. There will be anatomical surgical drawings that I've drawn. There'll be endoscopic surgical videos with snippets with an average attention learning span on social media being 30 seconds to 2 minutes at the max. There'll be BTS. Sorry, Mankyu is not from Korea. That's not BTS. It's behind the scenes, basically. So there'll be polls and questionnaires. There'll be scientific papers that are reviewed on LinkedIn that have increased their hits that were never been possible without social media. There'll be comments, criticisms, whom to follow, and final thoughts. So we'll just go. This is a post where I mentioned about the J point and the average laminotomy and ULBD. This garnered almost 83 likes, 7 comments, 5 reposts. The second one is the right-sided approach, on which I try to always mention more and more. I get criticism as well as comments and things. This was the third post. Then again, it was about that on the first day of the course, I was telling about what is the difference between a 0-degree scope and a 30-degree scope. I tried to explain it through my social media account, and people have benefited innumerably. I've got stories from surgeons all over the world that they have benefited with education through social media. Then this is the difference between a left-sided approach and a right-sided approach for cage insertion. This again got a lot of... Now you'll see these images are not perfect. They seem to be drawn like by a child of 3rd grade or 4th grade. But social media doesn't want perfectionism. It wants humans. And human beings are imperfect. If you try to bring perfection, you try to bring artificiality, and that it doesn't like. So some surgical videos. This was my teaching of how I detach the lateral recess, decompression, and how I detach the ligamentum flavum from the lateral recess. This garnered almost 95 likes, 10 comments, and almost 10 reposts. This is one of the examples. Just imagine a surgeon who is sitting in maybe Burundi or somewhere in Africa or Asia who is learning about these things, and he doesn't have access to all these great European faculties and Asian faculties who are top guys, and he can or she can access them at the ease of his work, from the ease while having a dinner or lunch. He can see all these things. One more video, this gained a lot of 160 likes, 20 comments. This was I'm describing about meningovertebral ligaments or a dural trap. You know, we try to apply the principles of microscopic spine surgery to biportal endoscopy, but as my friend from Ukraine just told, it's not the same. There are multiple things. You can't just pull the phleum off. You need to separate that meningovertebral attachments. This was one more video of medial wall of the caudal pedicle that I tried to demonstrate with the help of a biportal endoscopy. This is again the J points. So I keep on talking about the most critical elements like the right-sided approach, the J point, which I think that most of the surgeons, they don't know and they need to understand because it's a different surgical endoscopic anatomy of the lumbar spine, which is very different from your microscopic or an open spine anatomy. So some polls and questions. I took a poll on UBE till if, what is your preferred bone graft? So most of them mentioned it is an autograft. I personally felt that UBE didn't give that much of an autograft and had to sometimes use a iliac crest bone graft, but all said and done. This was a second poll. I asked a very burning question. What advice will you give a fresh postgraduate orthopedic or neurosurgery residents who are endoscopic and who are interested to learn endoscopic spine surgery? Most of them told that they should gain an open or an MIS experience before venturing into this super specialty. Then I again asked, with UB and monoportal endoscopic surgeons like Vincent may be a dying breed. They may become like mammoths. So that's how they become more valuable to us. So most of the surgeons told, yeah, we should learn both the techniques. So biportal is there, but you should also learn monoportal. That's my message. So some important and often neglected papers, like this is a beautiful paper by DJ Choi. Someone showed this photo yesterday. I reviewed this paper almost 9 months ago, and the hits on the download hits were increased. It got 199 likes, 10 comments, and 12 reposts. Can you imagine the number of people that must have seen this and found this valuable in their practice, and how much they have gained? This is one more paper, a beautiful demonstration of where to place your portals. This I had reviewed almost a year ago, gaining 136 likes, 6 comments. And this paper also, these authors told me that the demand, they had more downloads from this. So some BTS, like I told, this was a 1-minute video where I explained how to hold an arthroscope before you insert. I got criticized by a British surgeon that I was not wearing a double glow. So after that, I was going to change it after that. So this is one more video of draping technique. So many people, many surgeons are not doing endoscopy because they don't have specialized drapes available in their thing. I learned this technique from Korean surgeons as well. So they use a drape placed in a U-shaped manner, and then they patch it up with an IO band in order to facilitate the outflowing saline. Some priceless moments. This is a video of Dr. Dimitrios explained, a viral video, 200 plus likes, 11 comments, in which he explained with just a finger that he just shut off the outflowing fluid. He found the bleeder and he could perform his step by just momentarily increasing the intercanalicular hydrostatic pressure. So these kind of things. This is the video of Mankiw. You can see it on LinkedIn, on YouTube. I learned the release of superficial ligament from the deep ligament from this video. This is the video of Dr. Malcolm explaining UB endotilips and the complete extrafleval approach to tilips. This is a post of Ariel describing his technique, the butterfly, and mentioning the details on social media. This is the post by Guillaume explaining how a surgeon like Philip Fan, I don't know if he's here in this room, he learned endoscopic spine surgery and what process he followed. So if someone doesn't have an access to these kind of things, these kind of excellent lectures and presentations, he can follow these steps. He has completely made it organized. So this is Elsa explaining her technique of doing a right side, decompression. This is Eduardo, who mentioned Eduardo comes from the town of fishing a lot of fish in Porto. So he fished out this disc on a Sunday morning. I loved that presentation, and it's all about story. You know, Joseph, he always says that I don't like to demonstrate my cases, but Joseph, I have a hidden man that sees your cases. So I have your photos while you're operating. And he has beautifully explained how he positions the patient, how beautifully he has done the lamina foraminotomy in this cervical case. And my friend Francois, his viral post on 868, this was completely viral. This how he has done a C1 posterior mass excision laminectomy using UBE, and this was crazy. Like it's not been documented, I think, till now. And Professor Kern teaching ethics, as we all know, on the very nicely told about ethics. And this is, I would like everyone to take a photo of this and follow this page on Facebook. This is Professor Master Son, who is one of the biggest masters of endoscopic spine surgery. And he has some fantastic videos if you go on Facebook. But just don't try to see any other things and don't get distracted apart from UB on Facebook. So literally speaking, these masters are just giving away their trade secrets for free of cost. They are like, if there is a seeker in this class, even if one person benefits from this particular lecture, my trip of coming to Europe from India will be benefited. You should learn from all of them. You should try to find and learn from all of them, whoever are giving away their secrets. So this kind of, Christoph Young recognized my UB videos. He mentioned in SMS Las Vegas. Sorry, I couldn't be there, but at least my post was there in Las Vegas. So I was happy. So what not to do in social media? Never try to criticize, never try to corner, never try to attack, never try to follow anyone blindly. You should always check the credibility of a speaker. But, you know, as I always say, it's better to be attacked than ignored. So it's, but never try to do anything to others. Okay? So, you know, Warren Buffett has told, read 500 pages every day. That's how knowledge works. It builds up like compound interest. We can't read, practically speaking, 500 pages, not even 100, not even 50. What we can do is to read, go through at least quality posts on social media and to compound our knowledge with UB. And I want to add that here, just don't be a consumer, be a creator. Try to apply the principles of adult learning in your practice, because they say teaching is learning twice. So always try to be a creator, because that's how you'll understand how to consume the content in a proper manner that benefits you, that helps you. Like they say, people don't care how much you know unless they know how much you care. So that's how. Always try to care more about what the person who wants to know. And what to do, why you won't post, because there will be a fear of failure or fear of criticism, and my solution is simple. Just do it. Thank you. So for the seeker, I'm in France, I can't ignore and Joseph, Napoleon, my Napoleon from France. The last words of Napoleon were France, Army, and Josephine. Your words as a seeker in endoscopic and bipodal endoscopy should be spine, endoscopy, and UBE. So, no take-home message, take-home homework for adult learners. So create a LinkedIn account if you don't have. Follow the KOLs and DOLs. Follow all the masters in this masterclass on LinkedIn, YouTube, Facebook, and continue learning till the second UB masterclass of ESUBE, which will be in Seville under Dr. Ariel. And create content, because to create something and to teach someone is to learn twice. So I want you to learn. Everyone wants to be doing endoscopic and UB most of the times. Thank you. Thank you. Thank you for your patience.
Congratulations, Ashwin. I'm very happy to see this presentation. Just a quick question, because when I do a post, it takes me maybe 20 minutes to do it, to do a lot of smiley, etc.
Yeah.
How much it takes to you by day?
Now, because I've been doing this for so long, 2 minutes to 5 minutes. The most important thing is you don't need to put smileys and everything in LinkedIn post. So it's all about stories that you're going to tell. And it's all about the ease of learning and the ease for the reader to read it. Like it should have a good buttery feeling, like you're reading, going, you don't want to stop. You just keep on going, going, going till the end, and you try to give them something.
Thank
That's
you.
it.
I have a question for Ashwin.
Yes.
You mentioned that you use LinkedIn, and it's your focused social media for professional.
Yeah.
And do you use other media for your patient community, like I don't know, X or TikTok or?
No, I try to do Instagram sometimes, but I'll have to learn it from Javier or Jose or someone.
Okay.
I don't do it for patients.
Okay.
Okay.
Thank you.
Thank you, Ashwin,
Thank you.
for your
Thank you.
brilliant presentation.